So there's all these unfavorable changes that happen with animal protein that drives the formation of kidney stones. So animal protein has more acid. They increase calcium excretion. They lower urine pH. They increase uric acid. Those who do eat a vegetarian diet have a lower risk of forming kidney stones. That's been shown in a number of studies now. If you have antibiotics, you're recently exposed to antibiotics, you can affect your microbiome and increase the amount of urine oxalate and increase your risk of having kidney stones.
Welcome to the Kurisko Company podcast. I'm your host, Dr. Lee Kurisko. Our guest today is Dr. Shivam Joshi, MD, who is a clinical assistant professor of medicine, nephrologist, and lifestyle medicine at the New York University School of Medicine. He has an interest in plant-based health and evolutionary diets. Dr. Joshi has over a dozen peer-reviewed scientific articles published and is currently working on a book about the adverse effect of carnivorous diets. Welcome, Dr. Joshi.
Thank you for having me.
Well, yeah, we're really pleased to have you. Now, having had serious issues with kidney stones a number of years ago myself, I find the relationship between diet and kidney health and function very interesting. And I think a lot of doctors have no concept that there's a relationship. You know, as a diagnostic radiologist, I see kidney stones every day, and almost every day there's somebody that's scheduled for a contrast diffuse CT who has impaired renal function. And so we have to make contingent plans about that. So what is the relationship between plant versus animal protein and kidney health?
Yeah, so there's actually a lot of literature that's come out, and perhaps that's why many people aren't aware, because maybe they never were taught this or never learned it. But in just the past decade, we now know a lot. And we know that animal protein is actually a big driver. Going back to kidney stones, they're a big driver of kidney stones. Animal protein has more acid. They increase calcium excretion. They lower urine pH. They increase uric acid. So there's all these unfavorable changes that happen with animal protein that drives the formation of kidney stones. So, and I see this day in and day out. I'm in hot and sunny Florida, and patients here eat the standard American diet. They don't drink enough water, and lo and behold, they have kidney stones and recurrent kidney stones, which are preventable.
Mm-hmm. Yeah, well, when I had my issues with kidney stones, at this point it must be more than 10 years, since I've been on a plant-based diet, everything's been fine. And I was given advice about, hydration. I was put on a supplement with pyridoxine, and no one said a word about my diet, so I went for years and I didn't realize that there was actually a connection there. Like, what are the mechanisms between diet and forming the stones?
Yeah, so animal protein facilitates the formation of kidney stones through a variety of ways. The biggest one is that it's acidic. So you have acidic foods, you have alkaline foods. Most folks have heard of alkaline water. It's the same concept. So the animal protein in general is acidic. That acid enters the blood, then it goes into the urine, and then because the urine is acidic, it then creates a favorable environment for the formation of stones. Most common form of stone is a calcium oxalate stone, and that stone forms in an acidic urine. So the simplest way to prevent the formation of a calcium oxalate stone, 80% of people have this type of stone, is by raising the urine pH. Actually, the simplest is actually to drink more water. And most people know that. They get that information by the time they come to see me. Whether they're doing that adequately or enough is a different story, but they at least know that they need to drink more water. The second thing is the animal protein and the urine pH issue. I recommend patients, you don't have to go vegan or vegetarian. Obviously, if you do, that's better. And the literature shows that those who do eat a vegetarian diet have a lower risk of forming kidney stones. That's been shown in a number of studies now. But if you just eat enough fruits and vegetables with every meal, you can reduce your risk of forming calcium oxalate stones. So the most common treatment, go ahead.
Oh, I was just going to say, there's also the factor of the intestinal microbiome, isn't there? Like, if you eat a more plant-based diet, don't you have more organisms in your gut to metabolize that oxalate so that you're not recirculating it into your kidneys?
Oh, absolutely. So I'm glad that you brought that up. So that is so I often so when I tell patients to eat more fruits and vegetables to raise the urine pH, they often say, "Well, I was told not to eat many plant foods because of the oxalate content," and
Mm-hmm.
that's not actually true. So there's a lot of reasons why someone's urine oxalate may not actually be elevated. So one of them is the gut microbiome, and what we've seen in studies is that people who eat more oxalate in their diet tend to have more bacteria that digest that oxalate and then ultimately prevent it from coming into the urine, which is this interesting and fascinating concept um, aspect of the microbiome. The other thing is the amount of calcium you eat in your diet can also affect how much oxalate is being absorbed and also how much fat you are eating in the diet. So there's a variety of a few things that can affect how much oxalate that comes into the urine. And antibiotics are a big thing. If you have antibiotics, you're recently exposed to antibiotics, you can affect your microbiome and increase the amount of urine oxalate uh, and increase your risk of having kidney stones. So another reason why antibiotics aren't good, but of course they do serve a life-saving purpose. So if you need them, you need them. But if you can avoid it, then worth saving your microbiome.
Yeah, now, Dr. Greger, whom I'm sure you're familiar with, he advises that if you have a history of oxalate kidney stones, to avoid, uh, I believe it was beet greens, spinach, and chard. And so I kind of try to avoid those things. Is that a reasonable thing to do, or do I have to not worry about it now that I'm on a 100% plant-based diet?
Yeah, so if you have, so it depends on what was the cause of the kidney stones. So the it, I'll share my own experience as an example. So for example, when I was in high school, I was eating TV dinners to bulk up and join the football team.
Yeah.
The football coach said I was too small, too scrawny, and I needed to eat. So I was eating these TV dinners. After about a month, I got a kidney stone. The TV
Mm-hmm.
dinners, I didn't know it at the time, but now I do. The TV dinners are high in salt, they're high in
Mm-hmm.
fat, they are high in animal protein, and probably I wasn't getting enough water. So you throw that mixture in, and that's how I formed kidney stones. So that has since been undone, and now I eat spinach, and I haven't had a problem. Swiss chard, no problem. Beet greens, nuts, even almond milk, I don't have an issue. But that's me.
Mm-hmm.
Most people, when you look at the literature, don't have a high urine oxalate as the cause of their kidney stones. It's actually a minority. Generally, the biggest driver of people having kidney stones is a low urine volume, meaning they're not getting enough water, and also a low urine pH, meaning that they're getting too much acid in their diet. So,
Mm-hmm.
for most people, I don't recommend limiting dietary oxalate unless you know that you have an oxalate issue in your urine, that your urine oxalate is high. So,
Mm-hmm.
for folks who do have that problem, you've had a 24-hour urine collection, and the doctor has told you, a nephrologist has said you have high urine oxalate, then those folks, I do restrict it because it
Okay.
probably isn't helping the situation.
Yeah, that sounds reasonable. Now, I was not aware of the relationship to fat in kidney stones. Can you elaborate on that?
Yeah, so it's a little complex, but if you follow me, I can explain it. So calcium binds to oxalate. It binds in the urine, forms a kidney stone. It can also bind in your gut. So if you eat, let's say you're having spinach, and you don't want the oxalate in that spinach to be absorbed, you can have something high in calcium, like a dairy or non-dairy based beverage that's calcium fortified, and you take it with the spinach, the calcium will bind to the oxalate, and your urine should not have that big of an increase in the urine oxalate thereafter.
Okay.
Now,
Okay.
now let's say you eat a high fat something, you pour a ton of olive oil on your spinach, then the fat will bind to the calcium and then prevent the prevent the calcium from being bound to the oxalate. So then the oxalate will be rendered free to be absorbed and then come into the urine. So
Yeah,
this
that
is
makes
why in
sense.
the recommendations they say to eat a low fat calcium food if you're having high oxalate.
Okay, okay.
Does that make
Now,
sense?
you mentioned about the animal foods being relatively more acidic. That is driven by the amino acid methionine primarily, isn't it?
Methionine, and there is another one that is escaping me off the top of my head. There's a
Cysteine?
couple of them.
Is it
Yeah,
cysteine?
I I believe so.
Yeah.
But yeah,
Um, so um, now it's also thought that that drives the decline in renal function. Well, I mean, maybe you could better explain why the ongoing consumption of animal protein undermines renal function.
yeah. So animal protein also has can affect the kidney in some of the same ways. So the the acid in animal foods makes it harder for the kidneys to essentially do its job. So the acid. So if we go back to healthy kidneys, the acid that we consume in our foods enters our blood and then is ultimately excreted in the urine. That's one of the many jobs that kidneys do. And uh, when the kidneys are impaired, that acid accumulates. And then over time, because of the excess acid in the blood and also in the kidney, this leads to a gradual, faster deterioration of the kidneys. And this has been shown in several studies, including randomized controlled trials. So it is recommended to eat plant foods to help neutralize this acid. And actually, the latest KDIGO guidelines recommend a plant-based diet for a variety of reasons, including this, um, to help neutralize this acid. And by doing so, the most common way of treating uh, the acid that accumulates in the blood, which is called metabolic acidosis, is through a prescription sodium bicarbonate. But this can be achieved with fruits and vegetables, which is interesting because it's almost the same phenomenon or philosophy is happening with kidney stones. One of the most common treatments for kidney stones is potassium citrate, which is another uh, uh, alkali, like sodium bicarbonate. And that is given to patients who have recurrent kidney stones to help neutralize acid and prevent the formation of kidney stones. But this can also be achieved by eating fruits and vegetables.
Mm-hmm. Mm-hmm. Yeah, unfortunately, sometimes that's a hard sell for patients to consume more fruits and vegetables. Um, so, this effect of the relative acidity is functioning independent of the elevated risk for, diabetic nephropathy and, hypertensive nephropathy that you would get from eating a more meat-based diet. Is that correct?
Exactly. So there's a lot of reasons. So the increased risk of and when I give my lectures, I have this diagram and it points to all the different ways that animal protein can affect kidney health. But you're absolutely right. So the increased animal protein increases the risk of hypertension, diabetes, worsening diabetes, hypertension, and ultimately that can affect kidney health as well. And then animal protein itself in studies has been shown to increase pressure within the glomerulus, what's inside the kidney, compared to plant protein. And then you have the acid issue. There's also a phosphorus component to this, where animal protein has higher bioavailable phosphorus, which can be
Mm-hmm.
problematic. So there's a number of reasons why uh, folks who have kidney disease should eat plant based.
Now, phytates are a source of phosphorus in plants, but they actually aren't they? They're beneficial for the kidney, are they not?
Yeah, so actually for humans, so there's a lot of controversy with phytates. People consider phytates to be anti-nutrients, and because of that, many folks have been avoiding eating foods that have phytates like whole grains and things like that. But when it comes to kidney disease, those phytates actually are beneficial because they reduce the absorption of phosphorus. So phosphorus is not an element that we think about frequently, especially if you don't have kidney disease. But if you do, it's something that's more on one's mind. Phosphorus is not disclosed on nutrition labels, which makes it hard for patients to avoid. So they have to often take phosphorus binders. But what we've seen in studies is that eating more plant-based, because of the phytate, they absorb less phosphorus, have lower phosphorus levels, and ultimately have less of an overall issue with this.
Right, right, yeah. Um, now, what about the oxalates per se? Do they have an effect on renal function, or is it just a stone issue with the oxalates?
The oxalates, if significant enough and um, frequent enough, they can affect kidney function. So if you have a calcium oxalate stone
Mm,
blocking your kidney, then you can lose kidney function that way. Some people actually have so much oxalate that deposits into the tissues of the kidneys, and that's a big
mm,
problem. Most of those folks have primary hyperoxaluria, a genetic defect in their metabolism of oxalate. But it is possible, but that severity is, or that condition is generally the minority. The majority of cases, people are forming stones every 6 months or 12 months or a year or two, and they have to have it taken out, or it's painful, and they want this cycle to end.
yeah,
So that's where my job comes in, and I help them with that.
yeah. I can speak from experience. It is not a pleasant. It is not pleasant to have to deal with kidney stones. I was in the unfortunate circumstance where I had kidneys in both ureters simultaneously,
Oh wow.
and I went into acute renal failure. It was kind of a mess. Now, do the branched chain amino acids, such as leucine, do they have any effect on renal health? With the background that branched chain amino acids tend to be higher in animal products, or is it just the methionine and the cysteine?
Yeah. So it's I'm not entirely sure if the amino acids that are higher in animal products are really the underlying cause. Perhaps they might be. So the several studies that I know of this have looked at it and have associated it with it. Adverse issues with these amino acids are higher in animal foods. However, it may just be that these amino acids tend to be found in higher quantities in animal foods compared to plant foods. So
Mm-hmm.
there is that confounding, and I don't know if that issue has been resolved. But one of the interesting aspects of amino acids and kidney health is that if you remove the nitrogen component of amino acids and you consume them as keto acid analogs, which has been done, you can avoid the increased glomerular pressure that occurs with amino acids in general and preserve kidney function or slow the rate of deterioration. And that's also in the guidelines and has been used occasionally to help slow down the progression of kidney disease.
So it's the nitrogenous part of the amino acids may be part of the issue then.
Yeah, that's our current understanding as to why hyperfiltration and increased glomerular pressure occurs and ultimately leading to declining kidney function. Obviously, if you didn't eat any protein, then there would be no strain on the kidney, but that it's also a non-survivable condition because you need protein for basic life function. But
Mm-hmm.
people have found ways to circumvent this by eating very low amounts of protein supplemented with these keto acid analogs.
Well, what do you consider like an appropriate intake of protein for the average person, like say per kilogram of body weight?
Yeah, so the right now in the standard American diet, we're eating about 1.2 to 1.5 grams per kilogram per day, which is probably more than we need. And that comes at the expense of including perhaps high fiber foods,
Mm-hmm.
complex carbohydrates. So that is more than what we need. What the guidelines say is between zero point 0.6 to zero point 0.8 grams per kilogram per day for people without kidney disease is enough to cover between 50 and 95% of the population's needs for protein in that range. Going above that, you're entering beyond the 95th percentile of needs. Now, if you have kidney disease, interestingly enough, the amount of protein recommended is the same amount, zero point 0.6 to zero point 0.8 grams per kilogram per day. There's slight deviations depending on which paper and which guidelines and what year it was published, but generally they fall into that ballpark. And so that's the unique aspect about treating kidney disease and recommending dietary change is that the amount of protein recommended is the amount of protein that we all should have been consuming all along. But it's just that in our average American diet, we eat double or more of the protein that's
Mm-hmm.
recommended, and that can
Mm-hmm.
be problematic for ailing kidneys.
Yeah, no, I've worked out with weights and stuff for years, and my understanding is that the optimal amount of protein to get to build muscle is, they say, 1.3 to 1.6 grams per kilo of ideal body weight, which to me, that it strikes me as high. And I've actually gone through periods of been able to build muscle not getting that much. And there are some very successful plant-based athletes and strength athletes. Um, are they if they are very conscious about their protein intake and they're taking a plant-based protein supplement? Is there any harm? Is there a point at which even plant protein can become harmful?
Yeah, I would say so. So plant protein is less demanding on the kidneys, but if you eat enough of it, if you have stage 4 kidney disease and you eat enough of it, you're still getting that nitrogen, and that
Hmm.
nitrogen is affecting the kidney function. And we know that increased protein intake leads to increased pressure in the glomerulus. So even if you're eating plant protein, you still don't want to overdo it. If you eat plant protein, some people have recommended a 10% modifier, meaning that you get 10% more than what is recommended by standard, to take into account some bioavailability issues of the protein and decreased absorption, especially if you're above the age of 50. But other than that, I would say, definitely don't go like 2 grams per kilogram or something astronomical.
Well, it's common in sort of the bodybuilding weight training world to recommend a gram per pound of body weight as a minimum, which just seems insane.
Yeah.
Uh, like total overkill. Have you had success reversing renal disease with plant-based diet, or do you just see that things sort of flatten out rather than continue to decline?
Yeah, so to comment on the last thing, and that was for kidney disease. So if you don't have kidney disease and you're eating tons of protein, you should be fine. Kidney should be
Okay.
able to handle it. But if you do have kidney disease, very, very important to make sure you're not uh, consuming tons and tons of protein. To answer your question, I reversing kidney disease. Kidney disease generally is a one-way street. So
Hmm. Hmm.
some people have a reversible injury that, uh, like they were dehydrated, the kidney function went down. They're in the hospital. They got better from diarrhea. We see this all the time. Someone gets
Hmm.
norovirus, kidney function gets better. That's called acute kidney injury. But chronic kidney disease generally is a progressive pattern of fibrosis in the kidney, and as you as a radiologist, you can see the cortical atrophy, the shrinking of the kidneys. That usually is a one-way street. However, there was a big paper published about 20 years ago in New England showing that people who had diabetic kidney disease on biopsy were able to reverse that diabetic kidney disease after they got a pancreas transplant. This was in type 1
Oh,
diabetics.
wow.
That changed our concept and understanding of kidney disease probably forever. Not much has been built upon that, probably because it's hard to reverse someone's diabetes, chronic diabetes, unless they're serious in intent. And the current healthcare system, it's hard to provide folks with the requisite number of resources to do that, especially if they have chronic kidney disease. Not that saying that it's impossible. We certainly encourage it. However, what I have seen more commonly is that when you have chronic kidney disease and it progresses to such an advanced stage, um, uh, folks often come to me for a second opinion saying, do I really need dialysis? And when I tell them the things that they could do to slow down the progression, of course, I wish they came to me a little bit sooner or earlier in their disease course, but by the time they get to me, they're usually stage 4, stage 5. And some of them have even been told you need to start dialysis. So when they come to see me, it's a little bit of a tall order, but I explain to them reducing protein intake, which also reduces the generation of uremic toxins, changing to plant foods, and doing a number of other things, staying hydrated, avoiding nephrotoxins like or medications that can cause problems. They can delay. And some people have avoided dialysis for up to a year. I'm not saying that
Hmm.
this is the standard, and everyone should be doing this, but for some people, depending on their disease, some people have been able to delay the need to dialysis, and that's actually been shown in the literature too with eating a low protein diet.
Yeah, that's really interesting. Now, just switching gears, um, on if you go to social media like YouTube, there's a lot of these advocates promoting a carnivore diet. And I notice that they have huge followings, I believe, because they're telling people what they want to hear. And so it's more of an uphill battle if you're promoting a plant based diet. But what are your thoughts on this whole carnivore movement? I would assume that as a nephrologist and the fact that you're working on a book on this, you have some strong thoughts about this.
So definitely telling people what they want to hear, gets a lot of attention, and people love hearing that. I probably should go and create a profile and say, hey, you don't need to exercise and you'll do just fine in life, and I'll probably have 1 million followers. But no, as a nephrologist, I don't recommend it. There's a lot of benefits to eating plant foods: the fiber, microbiome, the potassium for hypertension, the acid for kidney stones. Even with the ketogenic diet, which the traditional ketogenic diet was recommending predominantly animal source foods, we saw an increase in kidney stones in a variety of papers. And that was related to that plant protein, that acid. There wasn't just enough alkali coming in, and actually some some proponents of the ketogenic diet actually even recommend supplementing with potassium citrate to prevent kidney stone because the risk is so high. So the carnivore diet is another iteration of these animal-based diets that have occurred over the years, from Atkins, South Beach, Paleo, Keto, and now we have just carnivore. I definitely don't recommend it. I don't think it's healthy, sustainable, or smart. And it's not natural. There's no, it's not. There's no culture that exclusively eats that much meat.
But Dr. Joshi, I thought human beings evolved to eat meat. What are
Yeah,
your
so I
thoughts
think
on that?
I think that's also another uh, thing that we like to believe and think. I think it feeds into a lot of stereotypes: men as hunters, women as the homemakers. And there's a lot of literature into this that uh, kind of calls this into question, but it doesn't get talked about enough. So during human evolution, what were women doing this entire time? So some people think that so we have forgotten perhaps what it was like to live without any of the things that we have, technology. How did people survive? Hunting wasn't always reliable. When we didn't have advanced tools, so the animals sometimes wouldn't be there. You didn't know where the animals were. Sometimes you might hunt and then another animal may come and take that, whatever you hunted. So when they look at indigenous societies in Africa, success rates of hunting weren't always 100%. So in times when it wasn't, when hunters weren't successful, they relied on the foods that were gathered by women, these fallback foods. And these foods actually contributed predominantly to most of the diet. And meat was seen as kind of um, uh, more of a I'm not the rule, but an occasional finding. And so that was recently, and that we're talking about 10,000 years. That probably isn't going back far enough to affect human evolution. We were definitely modern humans at that point. But if you go further back, we evolved from a primate lineage. Primates tend to eat more plant foods, fruits, leaves, twigs, things like that. So our microbiome or gut is similar to that, with some modifications. Probably because the foods that we eat are more energy dense. Some people say it's because there's a whole theory that maybe the reason human evolution took off is we started eating more tubers, potatoes, yucca, cassava, things like that, things that grow underground. Some people say it was meat. No one really knows for sure, but there's probably a lot of things that contributed to human evolution, maybe even cooking. Um, but this idea that we ate meat all the time is not true, and there's papers and studies even coming out now. They find that Neanderthals ate more plants than previously thought. So I think that, or if we had the opportunity to go back in time, we would see that we actually ate more plants than we acknowledge now.
Yeah, and of course we didn't have refrigerators to store the meat. Now, my understanding is that we're basically opportunists, and if you were successful bringing an animal down, it's calorie dense, and the challenge back in those days wasn't to live to 100; it was to live long enough to reproduce.
Yeah.
And so, if you had the opportunity to eat something calorie dense, it made sense to do it because the horizon wasn't nearly as long as modern humans, where we're trying to live to be 80, 90, 100. Um, so I read an article written by you on the Forks Over Knives website that you were explaining that human hunting actually really wasn't very successful until fairly recently, and you described the use of the Atlantal, I think it's called, for
Right.
sort of pitching spears. Tell us about that. That was new information to me.
Yeah, so I wrote that a while ago when I was really into that, doing deep dives into the literature. Um, so that's the other thing. We assume that it was easy to hunt. Hunting tools were effective. Um, uh, Prey were all abounding everywhere, and there was no competitors. In some of the books I read, even they say that humans were the ones hunted by these large mega carnivores like saber-toothed
Mm-hmm.
tigers that existed back. So it was not without risk. If you were running and you tripped and broke a bone, that would be the end. Or if you cut your foot and got an abscess, that would be the end. So hunting was not without its own risks and perils. And then if you say so the um, so if you had one of these modern spears and were able to hunt an animal, and you got the spear in them, you still have to follow the animal and track them for maybe a day until the animal succumbed from its wounds. It wasn't always an easy thing, or just going like how people go to the grocery store now and get their ribeye or chicken.
Mm-hmm. Mm-hmm. Yeah. Now, do you have any thoughts on sort of the human anatomy and physiology of us being herbivores versus carnivores?
Yeah, so there's, and I think this is why the debate continues, that our anatomy and physiology is not completely similar to a carnivore, like the predatory cats, or similar or exactly the same as our primate lineage that we evolved from. And it's some mixture. People point to the canines as being smaller, um, and that our small intestine decreased. Um, but uh, when I ask anthropologists, when I ask them this question, they said to look at modern science, health research, to see what diet is optimal for long-term health. And I thought that was interesting because, it kind of goes back to what you said, because whatever they ate at that time was really for survival. And is that a good reason to eat that way now? And other people have made this argument as well. Back in the Stone Age, murder, was a thing, incest, all these things that we don't do now in civilized society. People didn't have clothes, or who knows how life was back then. Doesn't mean that just because it happened then in the past, it should happen now. So after someone wrote me that, I thought that was interesting, and I thought maybe that's where debunking this or looking to this as much as I had might have reached its limit, and to look at where literature is now for an optimal diet for human health. And David Katz wrote a great paper about 10 years ago. Can we say what the best diet is for human health? And he goes through the different diets and compares them, and argues that, and it's the same thing that the Blue Zones argues, and Michael Pollan has said, eat a diet that is mostly plants.
Mm-hmm.
And that's been pretty consistent, and we see that in a lot of the guidelines. Different, and it doesn't matter what organ you're talking about or what disease. So there is a growing consensus on this. I think the holdouts are the folks that want to hear what they want to hear, and are kind of entrenched in that. But there's always folks like that, no matter what the topic is.
Right. Right. Yeah. You made a great comment in one of your articles on the Forks Over Knife website that if you're to look at human history, human and pre-human history, and compressed into 24 hours, we've only been eating meat for, I believe, 14 minutes. So it doesn't mean that we're optimally adapted physiologically to consuming meat.
Yeah, so I'm impressed that I, I wrote that. I wrote that so many years ago, but you're absolutely right. So, and it goes back to whether folks want to hear it, it's hard to explain evolution to many people in this country when so many people don't believe in evolution. But if you are open to hearing about it, if you look at human evolution, we evolved from not modern day chimpanzees, but what their ancestors. And if you go back far enough, there is a common lineage, and that slow evolution. From as you mentioned, most of that was eating plant foods to the best of our knowledge. It's only recently that we've been eating more and more animal-based foods. Even if you go back, uh, even in the 20th century, it was hard for people to get animal foods. It was expensive. It's only at certain times. That's why we have these associations on holidays going until now that you have a ham at Christmas or a turkey at Thanksgiving. These were foods, animal foods were just not easy to come by.
Mm-hmm. Yeah, yeah. And my understanding is in the last few recent decades, the amount of consumed meat has really gone up a lot. It's not even what we consume now is really not even representative of what it would be early in the 20th century. We're consuming way more. I just have a couple more questions. We've encountered people that we've spoken to trying to help them out with the health issues, and we explain, the basis of a plant-based diet, and that they've gone to their regular practitioners and they've been shocked and say, "Oh, you can't eat fruit like that. I mean, that's going to drive your blood sugars up, whatever." What is the truth on fruit? Is it something that needs to be restrained, or can we eat lots of it without worry?
Yeah, so I think a lot of that just comes from lack of a good understanding on nutrition, lack of education, and just physicians' understandings of it being populated by their own gut instinct, what they read on uh, wherever they get their information from. But it's good that there are now, organizations dedicated to lifestyle medicine, like the American College of Lifestyle Medicine, to help kind of orient. And they put out guidelines and try to set the record straight. But fruit is healthy, and a lot of the patients that I see in the kidney space have been told not to eat fruits because of
Mm-hmm.
the potassium content or oxalate content. So when I tell them that no, you can have a banana or fruits, they're actually really excited and they want to eat it. And we go through it. And I ask them, what are your favorite fruits? What can you add throughout the day to help you, so that way you don't develop another painful kidney stone or your kidney function doesn't get worse. So I don't have to give you more sodium bicarbonate tablets. So I tell them they can have fruits, and fruits are even beneficial for patients with diabetes. It
Mm-hmm.
helps lower the insulin resistance component of diabetes. We know dietary fat worsens insulin resistance. Eating fruits helps with weight loss, which helps patients who have diabetes, especially type 2 diabetes. There are some fruits that have more sugar, natural sugar in them, that may be problematic, like your mangoes or your pineapples. Some of the fruits that we see now. So we talked about diet and evolution, and how human diet has changed evolution, but so has the food that we have eaten has also undergone an evolution. Fruit and plant foods are selectively bred to be appealing to us, the shopper, to buy and to ultimately consume. Uh, if you go back to fruits, 100 years ago, they were smaller. They had less of the fruitier portion, more fiber, they were less sweet. Uh, so, I kind of wonder, is it even possible to eat a diet that was reflective of, predominant plant-based diet that might have been reflective of human evolution? And it's an interesting question to ponder, especially now. Fruits now don't even have seeds in them. Some of them.
Mm-hmm.
Um, So it's interesting. But to answer your question, yes, I give folks the green light on fruits.
Mm-hmm. Mm-hmm. Just have one last question. And yeah, in one of the articles you had on Forbes, you mentioned the concept of calorie density. What's that all about, and how does it affect weight management?
Yeah, so the idea is to eat foods that are not so calorically dense. And it's interesting that this idea comes up a second time. So the nowadays caloric density is problematic. During human evolution, caloric density was very useful. You could eat less food, spend more time doing other things like building, some sort of residence or structure, or getting water or something like that. But now the caloric density is what makes foods hyper palatable. It increases the energy content, and consuming too much of it, as in ultra processed or processed foods, then leads to weight gain, obesity, insulin resistance, high blood pressure, diabetes, high cholesterol, all these issues that we see. So the idea is kind of to reverse it. And it all goes back to eating more fiber rich plant foods and reducing that caloric density. These foods are also higher in water content as opposed to sugar or fat, which then increases that caloric density.
Yeah, yeah. Now, you did you publish your book on the harmful effects of the carnivore diet? Has that been published or?
No, it's kind of just been put on hold on indefinite hold. I started working on it, and then life came in the way, and I I've I've recently been toying with the idea of trying to put a plant based or a kidney twist to it, as now the Amazon's full of folks writing about plant based diets, but there's not a whole lot for in the kidney space. So I may revisit it, but when I have time.
Yeah, well, I know how that works. Life gets in the way. Well, anyways, that's been great. We really appreciate having you on.
Yeah, thank you. No, I appreciate being here, and I enjoyed the conversation.
Well, thank you. I did too. Well, maybe we can do it again sometime.
Yeah, that'd be great.
Okay, thanks again.